what got you interested in
Okay.
surgical technology?
My name is Peter Walls. I've been interested in the surgical technology program for a few years. I know a gal who was actually in the program who did it, and she was like telling me that it was like, this is a super cool job, you know, you should check it out or whatnot. And I kind of kept that in my mind. I also, you know, I work in a hospital now, so I'm kind of familiar with you know, hospital environment. So I enjoy working in that type of environment. And there's many different ways of going about in a career in the medical field. And I picked surgical technology because, in a way, it's pretty intense. But it's not like an emergency room. You got someone just coming in. I mean, although we do some traumatic surgeries or whatnot, but it's kind of a controlled environment. So everything is like, you know, we try to, you know, stabilize the patient. We go in and we set up the field. We make sure we try to take care of the patient, patient's needs and all that. And also, we try to work with the doctors and other staff members to help the patient, and we just set up the room. We make sure all the equipment's there. Some of the medication, we deal with some of that too. And it's just like showtime, you know what I mean? It's just like you're there and you're going to be doing what you're doing, you're assisting, and you're part of the action. And then you get ready, clean up, and then you work on your next case. And also, I guess there's like a big demand for the medical field because of Obamacare and all that. And yeah, so it's also a great career choice, very stable job, and also pays fairly well too. That's another important factor.
That's good.
Yeah.
So have you seen any changes or growth? You want to run through?
Yeah.
Go ahead. Seen any changes or growth in the program or in healthcare in general?
Actually, I have. I wasn't sure if I was going to get into the surgical technology field, so I also tried the nursing field, and it's highly impacted from what I hear. I was even discouraged. Like, I talked to my counselor, and he's like, "No, you don't want to do that because it's just you're not going to get in, you know, unless you do this and that." So I've actually applied for a nursing program, and it was like a lottery, just like this place, you know. And it's like, well, and also the nursing degree, depending on what you're going for, you know, there's different levels of that. So the basic, I guess, is like registered nurse as an associate degree level, and then there's also BSN. So I've looked into those avenues or those venues, but what I liked about the surgical technology field is it's generally a one-year course or a associate's degree level course, and it seems pretty quick and simple. But the thing is, getting into this program here is also a lottery, and it took me 2 years to get in, and it took me several years to get all my prerequisites, you know, anatomy, medical terminology, English, you know, being able to read and write English, whatnot, and some math skills, and I think there were some other ones. But yeah, so that took a while, and it took me literally, I think, 5 semesters to actually get my anatomy class. And everybody who wants to get into any sort of medical field, even pre-med, you know, all those classes are impacted. It's really hard to get into.
Yeah. Awesome. So what do you think schools could be doing differently to help increase the number of healthcare workers coming out, especially 2-year schools? That's where a lot of the need is.
To increase it, it seems like for the medical field or whatnot, you can go ahead. It just seems like they're kind of upping the bar for their requirements to get hired. So, you know, a lot of people with less education would probably be overlooked, and they want someone with at least a bachelor's degree to get in. So I see the requirements to get into the healthcare field kind of like a little more stringent, you know what I mean? So as far as like getting more employees, probably you need more classes.
Yeah.
The main thing, you know what I mean? To kind of expand on that.
Okay.
Okay.
Anything else? Just give us your name and tell us what got you interested in healthcare and surgical technology.
My name is Jeremy De La Pena, and I got interested in surgical technology because I love handling instruments, and it's a fun thing to do. It's very intense, and I enjoy the healthcare field because you're helping people. You can provide them life, which is very important. And regardless of their condition, whether they have cancer or whatever else is going on, you can provide them a sense of hope. So it's pretty much the reason why.
And then have you seen any changes to the program or the healthcare field in light of the need for more healthcare workers? Or have things kind of stayed the same?
I think things it's kind of saturated.
Yeah.
I noticed, but as far as surgical technology is concerned, there is a growing need because there are a lot of baby boomers that are out there. So pretty much what's going on is that generation, we're going to have to take care of them. So there is a demand, may not be in California, but other places, and pretty much if there's a need and there's employment, some places people will go and get it. So, yeah.
And then what advice would you have for anybody interested in getting into your field?
Advice for the surgical tech program is that know your microbiology, your anatomy and physiology. There's a lot of questions related to different parts of the body, such as like your shoulder, your neck, your head especially, your abdomen. A lot of surgeries involve tools such as retractors, hemostats, clamps, different kind of staples, different kind of light holders even to like pull the light to and from certain areas. So yeah, there's a lot of different things that are coming out, and we got to learn that and learn, especially one thing is kind of cool is the Bovie electrocautery pen, which sutures, it closes blood vessels. So pretty much blood is stopped, and that's an important thing to do like in surgery to control flow. So with that said, like there's so many things coming out in sort of surgical technology to learn, and it's important to learn it. So that's it.
Any closing words?
Closing words, just I enjoy this, have fun. If you're trying to get into it, talk to Alice, talk to any of the students here, and we'll gladly help you out.
Awesome.
All right.
Thank you so much. Just your name and
Okay.
what got you interested in the field?
Yeah, my name is Alice Booker, and I've always been interested in getting back in the hospital. I have a little bit of a hospital background, just in the laboratory and then working on the patient's floor. So this is quite different because your patient is asleep.
So have you seen any changes to the program recently with the increased need for healthcare workers?
Well, we're hoping. We're hoping to all have jobs after we come out of our training and pass our, our certification, taking our test. I guess it'd be different in different areas in the country. Hopefully this area can support as many surge techs. But I believe this is the only program in the state of California in a community college. There is a program in the Bay Area at Los Politos, I think it's Los Politos, and but it's not completely junior college level. It's I think the students pay quite a bit to be part of that program.
And then did you have any advice for anybody else interested?
Oh my goodness. Do really well in anatomy. That is a really important factor. Make your anatomy experience recent, because if it's been a number of years, you may want to take another anatomy class. Because you really have to know, the parts of the body that you're going to be. And when you see those things written down on, the preference card, what type of surgery it is, in your mind, you need to know what part of the body you're going to be working on. And you want to just be the best for your surgeon and for your employer that you can be. I think that's the most important. part that I would recommend.
Anything else you want to add?
It's a great program. I think our instructors are such top-notch. Just today, after we went through a whole setup of a major abdominal surgery, of instruments and how to use the instruments, and then variations of setups, it's just so apparent that our instructors have just a vast amount of experience and knowledge that they're passing along to us. So we're just not learning what's this, what's that, but how to make, just how to be instrumental in making that surgery go as smooth as possible, and being the best patient care provider that we can be in our role as of a team. Thank you.